Welcome to the first 2022 episode of the Disease du Jour podcast. And we're starting the year with a bang. In this episode, we welcome Dr. Tom Riddle to talk to us about foaling. I'm your host, Kim Brown. I'm the publisher of Equine Management. The Disease du Jour podcast is brought to you in 2022 by Merck Animal Health. Tom Riddle, DVM DACT honorary, is a founding partner of Riddle Equine Hospital in Lexington, Kentucky. And he is going to be talking to us today about his decades-long experience of working in equine reproduction with thousands and thousands of mares and foals. The son of a veterinarian, Dr. Riddle graduated from Wake Forest University in 1974 and the University of Georgia College of Veterinary Medicine in 1978, and he's an honorary member of the American College of Theriogenologists. After graduation, Riddle served an internship with Dr. Don Witherspoon at Leslie Combs' Spendthrift Farm in Lexington, Kentucky, and worked another 3 years at Spendthrift. In 1982, Dr. Riddle joined Dr. Bill Rood to form Rood and Riddle Equine Hospital. In 1985, they purchased land on Georgetown Road and broke ground for their new building. And it has only grown since that time. Dr. Riddle has served as president of the Kentucky Association for Equine Practitioners, the Society for Theriogenologists, and the Theriogenology Foundation. He received the Steiner Award for Excellence in the Practice of Theriogenology. Dr. Riddle was the first person to recognize and report the 2001 abortion outbreak that became known as mare reproductive loss syndrome. And clinically, Dr. Riddle has special interests in uterine culture and cytology, early twin management, fetal sexing, and diagnostic ultrasound of a mare's reproductive tract. So welcome, Dr. Riddle, to the Disease du Jour podcast.
Thank you very much, Kim. I appreciate you having me on.
Well, this is a great topic, especially for new practitioners or those who might not have primary practice that involves equine reproduction, because we know that the breeding industry is heating up across the country. So maybe let's start with some of the most important things to prepare for and have on hand for veterinarians for the foaling season. So if someone is not a primary reproductive veterinarian, but suddenly they've got some pregnant mares in their practice, what sort of preparation or knowledge do you think they need this time of year to get ready for the foaling season?
I think that the new veterinarian will have everything that they need on their vehicle. They need a bucket, which most veterinarians have. They need to wash the mare with a clean soap, mild soap, such as ivory, and then they'll need some scissors in case there is a red bag presentation or premature placental separation that they need to address. And that's really all that they need. There are some other things they could have that would be fancier, but just a bucket and a mild soap like ivory and scissors will probably take care of most everything you need.
Well, that's pretty great to know that most things are already going to be on the practice vehicle. So is there something that a veterinarian you would recommend that they perhaps read or could study up on if they're, again, either new to practice or haven't had a lot of reproduction experience?
I think that there are numerous things on the internet that give very good advice, and there's some variation in the length of time they may predict for stage 1 of labor, but stage 2 of labor, I think most everybody is using a figure of 30 minutes, and I think that's correct. So go to your internet and look that up. Look up foaling tips.
Okay, that's a good tip on that. So let's talk a little bit about normal preparation for the foaling mare. So you may have a new owner, and then you may have a veterinarian that's not quite as experienced. How can that veterinarian help the owner recognize when stage 1 labor is starting and when to call the vet?
I think that that's a great question. And a new owner that isn't familiar with foaling would probably do well to send their mare to someone who has experience. Either that, or they need to call their veterinarian if their veterinarian is willing, and have the veterinarian be present, which is awfully hard to do because mares are pretty unpredictable, as you know.
Yeah.
And so I think that probably the best thing for a new person or a novice foaling person to do is to send the mare to someone who has preparation and knowledge.
Well, and that's a great tip. So let's talk a little bit about what do you tell owners that are maybe pre-foaling red alerts? I mean, this time of year, there's a lot of mares that are coming into being ready to foaling. So what should owners be alert for if they have not sent this mare off to someone who is very experienced in foaling?
I think that one big thing they need to look for is that mares may act colicky, which is an evidence of abdominal pain, and they need to not think she is immediately going to go into foaling. She may be just a little colicky, may be just a digestive upset, or it may be that stage 1 labor, she's getting the foal ready to enter the birth canal. And so they need to be aware that every mare is not foaling, that they may think is foaling. And so they need to guard for that.
Right. And I believe you had once told me early in my career that you really, if you're going to go check your mare at night, don't walk into the barn and turn the lights on, because mares kind of get a little touchy on changes when they're getting ready to foal.
They do. And so you want to have the mare very accustomed to your presence. Mares like quiet. They don't want to have anything that disturbs them. And so don't periodically enter your barn and cut on the lights. Try to sneak up on the mare, and ideally either have a foaling person there who the mare is very accustomed to their presence, or have a camera in the stall. And so you can watch her undetected.
Oh, that's some great advice. So when, again, we're going to consider that you have a novice owner for some of these, because, some of the experienced foaling people, you may never hear from them until it's time, the foal is on the ground and you want to go, do the check on the foal. But let's talk about the novice owner. So what might be a red alert pre-foaling? Let's say the mare has entered labor. So what are the things that you would tell a veterinarian to help their owner say, okay, this is when to call me and this is not when to call me? I mean, you mentioned a little bit of colicky, and that doesn't necessarily mean the mare's going into labor, but what really should alert, and that's a phone call to the vet?
The vet should be called if the foal isn't presented properly. When the mare goes into stage 2 labor, when she's really straining hard to deliver the foal and she's broken water, the owner should go in and make sure that the foal is being presented properly. And you want a foal that is got both front feet in the birth canal, the nostrils, the nose, the head are usually going to be behind the front feet. The foal should be much like they're diving. They should have, the soles should be down, the top of the hoof should be up, and you're going to want to have the head a little ways behind the mare's front feet.
And if they check that foal and it is not in position, one leg's back, they're not feeling the nose or the head right behind those front feet, that's time to call the vet. How much time do you have to get there?
After the mare has broken water, I think it's very common knowledge that you have about 30 minutes. They're not like humans. A lot of people think that they can wait a while after the mare has broken water, but you can't. Once the mare has broken water, you've got about 30 minutes to get that foal out on the ground. And so you need to keep that in mind. And if everything is not in order, presented properly, you need to have a plan with either someone who's a very accustomed, very practiced foaling person or your veterinarian that they can get there right away. So you need to keep in mind, if your veterinarian is 10 minutes away, that's great. But if they're an hour away in the middle of the night, you need to allow them some time to get up and get dressed and get ready to come to your way. And so you're not going to have that benefit of that much time.
Yeah, and that's a good point to make, and that's a good thing that maybe some of these veterinarians can use to encourage some of these novice foaling owners to have someone either on hand or send the mare someplace where they have more experienced help there on the farm.
You're exactly right. You're exactly right.
Okay, so we have talked about the foal, let's say, is in proper position, the mare is pushing, and then everything stops. She can't make any more progress. A lot of people want to start pulling on those feet. So what is your advice to veterinarians to tell owners? Again, hopefully the veterinarian, if there's been problems ahead of time, that they will have been called already. But let's say the foal is starting and gets hip locked or gets stuck.
About 80% of the time, the new foal owner, the foaling novice, is going to have no problem at all. The foal is going to be presented properly and is going to come out. But if you have, you're in that 20% of the time with the mare's not progressing properly with their pregnancy, then you need to either have your veterinarian there, or the mare needs to be at a foaling facility that is accustomed to foaling.
Right. And I remember when you were, and I'm sure most veterinarians have hopefully had some of this in vet school, but we also know that the pandemic has caused a little bit of issues with new graduates being able to get as much hands-on experience as they wanted. So if you're the veterinarian and you've been called and you are on hand, what are some of the tips to help these mares when they are foaling if you're the veterinarian on hand?
If you're the veterinarian on hand and the mare, say, isn't progressing with her stage 2 labor, you need to first check to see that the foal is presented properly. If it's not, then you need to get it in proper position, proper presentation. If that is not possible, then you're probably going to need to send her to a clinic and let them foal her there.
Okay. Yeah, because I know that you have actually helped in some of the techniques that are now used with some of these mares, like the mare in the air, and some using different types of sedation and maneuvering of these mares to help them out. And that's something that needs to be done with extra hands that are experienced.
Exactly. You need experience with that. And if you don't have it yourself, then don't hesitate to say, we need to send her to a facility that does have experience.
Today's Disease du Jour podcast is brought to you by Merck Animal Health, the maker of prestige vaccines, Banamine, Panacur, Regimate, Protozil, and other trusted equine health solutions. Merck Animal Health works for you and for horses. Learn more about Merck Animal Health's comprehensive portfolio of products, as well as their ongoing investment in our industry, profession, and community through programs such as the Respiratory Biosurveillance Program at MerckAnimalHealthUSA.com. So let's say that everything went great. The veterinarian did not have to attend the foaling. How soon do you recommend that veterinarian go check out the mare and the foal, and what is that veterinarian looking for?
In most cases, if the foal is acting normal, the veterinarian doesn't need to go out until the following morning. Most mares foal at night. Not all, but most do. So the following morning is fine. They don't need to go out there right away. They should make sure that the placenta has been passed within 5 to 6 hours. If it's not, then there's a risk of a retained placenta, a very great risk. And usually it's the non-pregnant horn that's left in. And the mare may pass all the placenta except the non-pregnant horn. So you need to be aware of that. If the foal is acting normal, then you can still be in trouble with the mare if she hasn't passed her placenta, or if the foal hasn't defecated past its meconium, which is the first feces, within usually about 12 hours.
Okay. And I remember you had, when back in my early years, when you had attended, you always had the foaling attendant retain the placenta for the vet to check. And, they can just throw it in a bucket someplace. I mean, what are you checking for? You talked about retained placenta. What else are you looking for?
You need to hold on to that placenta for your veterinarian to look at. And the veterinarian wants to make sure that the entire placenta has been passed. And most placentas can be shaped like the capital letter F, which you'll have both horns to one side, and then the body of the uterus as the upright or vertical part of the letter. And so most mares, if they're going to retain part of the placenta, may retain either the non-pregnant horn or the non-pregnant horn and the entire placenta.
Wow. Okay. And what else might you look for on that might clue you in that the foal might have problems? Maybe some potential placentitis or something.
Placentas can be very, very deceiving to look at. So you need to be aware that any sort of discharge on the placenta is a possible indication of a problem. But any discoloration of the placenta itself may just be post-foaling changes that may happen with time in any normal placenta.
Okay.
One type of placentitis that has become common in central Kentucky, and I understand in other areas too, is nocardia. So if there is a peanut butter-like discharge on the placenta, especially on the body or the non-pregnant horn, that is a good indication of nocardia placentitis. And some of those can be fine. Some of those you can have a very weak foal that is going to need some help to get going.
Okay, and what kind of help would that be?
Anything from fluids to the foal to antibiotics that will give the foal a little extra help. You're going to need to possibly give the foal an enema. You're going to need to possibly give it some colostrum or some plasma.
And you had mentioned earlier about the making sure the foal had passed the meconium, and I know some owners and veterinarians recommend, enemas just routinely. Is that something you recommend?
I don't think that the average foal is going to need an enema. I think that most foals are going to pass their meconium without any sort of outside assistance.
Okay, and how about colostrum? I mean, I know it's important for the foals to nurse regularly and early after they fold. What is normal for that the veterinarian should advise the owner to be watching for?
Most foals will nurse within a couple of hours after they're delivered. And if they haven't nursed by 6 to 10 hours after foaling, then I think you need to supplement them with some colostrum. And the colostrum is the first milk that the mare has. It's usually a yellow, sticky sort of a substance. Give the foal about 6 to 8 ounces of colostrum about every 12 hours after they fold. It is possible to overfill the stomach, so you don't want to give more than about 8 to 12 ounces at a time.
And when you're talking about colostrum, you're looking for, some antibody transfer. When do you recommend testing for passive transfer of antibodies?
Usually I'm checking the mare at about 24 hours for the passive transfer of the antibodies. And you'll have most mares will, most foals will nurse that colostrum from the mare. And you should have enough IgG on hand after about 12 hours after nursing that the foal is going to show an adequate absorption of the IgG.
Okay, and what is the number that you like to say, hey, if they don't reach this number when we do the test, what do you suggest?
If they don't reach 400 on their IgGs after it's at least 12 hours since they nursed, then I think you're in trouble. And you're probably going to need to give them not just a colostrum transfusion, you're going to need to give them a plasma transfusion. And colostrum, I said, might have been misleading the way I said it, transfusion. Colostrum is by stomach tube, plasma is by IV transfusion.
And when you've got a great healthy foal on the ground and you've got a healthy mare afterwards, that's always a tremendous relief and reward. But what happens if you get in there and some of these folks haven't maybe had their mares checked early or, so forth. And if you've got people who are going to have mares that foal and you can, as a veterinarian, advise them early, what sort of vaccinations do you recommend and what schedule do you recommend pre-foaling?
Pre-foaling, the mare should have her boosters about 4 to 6 weeks before she foals to allow her ample time to build antibodies to pass to that foal. And you need to booster her with flu and tetanus. And then the other vaccines are those that the normal adult should get in your area. Everything from Eastern and Western encephalomyelitis to botulism. And you need to booster her for those about, as I said, about 4 to 6 weeks before foaling.
Okay. That's great. Okay. And when you're going in to do your check on these newborn foals the next morning, I know one of the things that you had advised early on, back when I lived in Kentucky and had some work on foaling farms, was to make sure and do a hands-on check of these newborn foals to check for rib fractures or anything else that might seem abnormal. You always encourage to get your hands on the foals. So what are you looking for, and how do you do those exams, Dr. Riddle?
First of all, you do need to get your hands on the foal, and you want to check their mouths and make sure they have a healthy pink gum color. You want to make sure that they don't have any obvious sign of milk from the nostrils or a cleft palate. I've never diagnosed a cleft palate by hand. They're usually too far back. So I'll tell you that. And then you're going to want to examine for rib fractures. And normally, a foal, you need to develop some practice and some techniques with palpating the ribs. But normally, if there's a rib fracture that's of concern, you're going to be able to feel that separation, feel that those ribs ending their ends. You're going to want to feel creptus, which is bone on bone.
Yeah. And is there anything else you can think of for maybe, again, for these veterinarians who might not be, quite as experienced with foaling whether they're early in their careers or have been in an area where they haven't had many foaling mares in their practice before? Any other advice that you can give to those vets this time of year?
I think a good physical exam of the mare and the foal when you go out is always helpful. And you need to, first of all, recognize what is normal, and then before you try to diagnose what is abnormal. If you are at all uncertain, I think that you should call on someone with experience in that to teach you.
And how do you find, you're talking about someone at maybe a local clinic or a university if you're out in private practice?
Yes, or an older practitioner who does have experience that's in your area to follow you up and say, yes, this is a normal foal, or no, it's not, and this is what I would do.
Cool. So in other words, never be afraid to reach out for help.
You're exactly right. You're exactly right.
Okay. Well, Dr. Riddle, is there anything else that you would like to add to any of this discussion about foaling mares and foals?
No. I think that from the time the mare breaks water till she produces a foal, you know that tradition says that she should produce a foal within an hour, a half hour. And so it's very unlike humans, because a human female can break water and maybe not deliver a baby for another 24 to 48 hours. So you want to know that there's a difference in the species, and if a mare breaks water, you need to have a foal on the ground within 30 minutes.
Okay. That's a good point to leave us on today. And we thank you very much for joining us again, Dr. Riddle, on this first podcast of 2022. And we hope everyone has a great foaling season. And again, reach out to some older practitioners or some more experienced folks who are used to foaling if you have any issues or problems that you're concerned about in your area. So thank you, Dr. Riddle, for joining me on this episode of Disease du Jour, and a big thanks to our listeners for joining us, and a special thanks to our 2022 sponsor, Merck Animal Health. We invite you to listen and rate episodes of Disease du Jour on iTunes, SoundCloud, Stitcher, or wherever you like to listen to your podcasts. And if you have any questions or suggestions, just send me an email at kbrown@equinenetwork.com. Disease du Jour is a production of the Equine Podcast Network, an entity of the Equine Network, LLC.